episode 4 of our 5-part series on dealing with injuries using a massage gun. We're going to look at anterior knee pain and how to help it. Let's go. So for exercise 1, we're going to look at the IT band, which runs just below the TFL, just up at the hip, down to the lateral side of the knee. And we're going to work right up and down there, and then we're going to use the flat head on this one. So Sarah's going to take the gun, we're going to stick it on set and tray. And because the IT band, it's a real flat muscle that goes all the way down, Sarah's going to run down and all the way back up for around a minute. This will help loosen both the hip, but any lateral pain that's around the knee, it's going to help there as well. We're going to do that for a minute. Nice heavy pressure on it, and that should feel comfortable. Then we're going to move on to the next exercise. And we're going to take the quads as a whole group instead of an individual muscle, and we're going to work from the hip down to just above the knee, staying away from the kneecap, and we're going to work on Sarah. So Sarah's going to take the gun and she's going to stick it on 7's tree. And what we're going to do is start on the lateral side of the quads and work up and down, and nice heavy pressure, Sarah, on the lateral side. But then when we get to the middle, we're going to ease off slightly. So we're going to work lateral to medial, so we'll work through the group. So ease off a little bit. Because the group of quads are such a big area, we can spend 5 minutes here. Heavy pressure, ease off, heavy pressure. And when you've done 5 minutes on that, we're going to go into exercise 3 to complete. Exercise 3, and our final exercise, we're going to use our bullet head to get into the tibialis anterior, which is the lower of the leg. Let's go on, Sarah. So to get yourself into position, we're going to take Sarah's leg and she's going to put her heel up on the table of the chair. Then she's going to take the massage gun. We're going to stick it on level 3, and we're going to start just above the ankle and all the way up the tibialis anterior, just below the knee. So we're going to spend about a minute here and just make sure you're staying on the tibialis anterior and you're not moving onto the bony joint here. So this is going to also help loosen up around the anterior of the knee and around the ankle as well. That's our 3 excellent exercises for anterior knee pain. We went through the IT band, covered the quads, and we went into the tibialis anterior. If pain does persist, make sure you go see somebody. We'll see you in the next one.